Good afternoon. This is Dr. Jim Dougal, Emergency Medicine. We're giving you part 5 of our presentations of what's going on here in Johns Creek, Georgia. As a member of the College of the Georgia College of Emergency Physicians and also the American College of Emergency Physician, our facility here is like a emergent care. We do surgery here, and we also do family care, but we also do emergency medicine here at our facility. We had I've been answering questions on Facebook. We had a question from Rick in Seattle, Washington, and it was a great question. And his question was, how do we fit a mask, or how do we put a mask on a proper way? And it was a great question because I'm going to show you, Jennifer's going to show you, we had a patient come in and actually wear this mask who came in. They came in and wore the mask, and they cut a hole in the middle because they said they couldn't really breathe very well. So when they came in, of course, we just looked and said, well, we're going to have to change this and show you how to do it properly. So why don't you take that off? This is the mask she should have had on, or one of our patient masks that we give when you come in here. Each person gets a mask, and she's going to put it on properly. She'll put it on each ear with her hair out of the way, and then she's going to take the middle and she's going to really clamp down along under her eyes, and then the next thing is we pull it down over her face. Now, this is the proper way, the best way you can use it. I have people on television, you'll see them talking to you, and they're like this. They have their nose out. It's useless. Also, what's not very good, if you have a beard and a mustache, this mask won't work at all for you because the beard will push the mask out, or the mustache, and air and particles will get in from underneath or even on top. So this is one of our patient masks. You can take that off. What we use here, we use our mask is the N95 mask we use here, but we also use, and you can hold that up for him, it's a mask respirator, and that's for the staff. We also use an 8511, which is similar. And what you do is you can put the 8511 on. You put it over in the back, you take both rubber, bring it back, all the way, this top one all the way back. Here, put the first one on first. She knows how to do it, she's just shy. We're going to put this first one on, move her hair out of the way. Got it, girl. It's going to come up, this is going to go to the back. Now this is going to shape, and what she's going to do is take both of her hands and hold the mask very tight. And she's going to breathe from it. Breathe in and out. Hold the mask tight for a pressure check. In and out. Okay. And that's how we try to use this mask properly. Now, we do the sniff test. We actually put a hood over our staff, and we introduce things into the hood, which checks to see the security of the mask. And that's what we do here for our staff. Okay, you can take that off. That's perfect. Another question that came in from Chicago from Robert was, and it was a great question, it's about social distancing in the food stores. I think the administration and physicians have to look at a few things. I think this is a big gap in the transmission of the coronavirus, because I see food stores where you go in where the people who are working there don't have any gloves, or they don't have a mask. Now, there's somebody at the front door who wipes the carts down, and everybody thinks that's wonderful. Of course, it is wonderful. But I went and I spoke at different food stores here in Georgia and in Chicago why they don't wear masks or gloves, and they made the statement that the administration of the stores think that would scare the people away. And in my opinion, it makes me more concerned, not afraid, that they're not wearing gloves or masks. So that's something that the administration really has to look at to protect the workers in the food stores and for us. Now, So what happens when you're in the food store? Well, if you're in there, you still want to create some distance. Before you go down the aisle, take a look. If the aisle has 4 or 5 people there, take the next aisle and wait and come back when that aisle's cleared. If you're going to the meat area and there's people waiting for orders, take some more time in the store, get the rest of the things you need with distance of 6 feet or as if you can. And then what we do is come back to the meat or produce center and then put your order in. You just have to be aware. You don't have to be afraid. You don't have to be overly concerned. But what you want to do is you want to keep that social distance, whether it's in the food store or whether it's out in the street or in a building. We've done that here. No one waits in our waiting room. They either come to our well area, which we're in right now, of 9 rooms in the trauma care area, or they go over to the sick area. The next question was from a patient in Georgia, or a person who wrote in Georgia, and they said, Dr. Dougal, what's happening with all these people coming from spring break? Are we in for another problem? Well, today's news and research, etc., shows that the coronavirus, COVID-19, is crossing all ages. We have a young baby who was reported she has coronavirus, but also we have other people coming back, waiting. So if they do come back from Florida or anywhere across the country, it's always good to kind of stay away from it, especially if you're elder. Okay, now the last thing we're going to do is I had other questions from around the country. How do we get hold of you at Step Medical Care? And what we've done and how do we do donations or anything particular, whether it's product or money, etc. What we're going to do is we wrote out here, Step Medical Care. This is our phone number, 770-623-6773. 770-623-6773. Like us on Facebook. Our videos will be there. Also, they wanted our address, Step Medical Care, 9690 Ventana Way, Johns Creek, Georgia, 30022. Step Medical Care, 9690 Ventana Way, Johns Creek, Georgia, 30022. All right. I want to thank everybody who's liked us. Oh, there we go. Light got me. I want to thank everybody who's liked us on Facebook. We're extremely tired through the weekend. It was very busy here with patients. But one more thing is we're seeing more fractures at home. We're seeing we've had fractures of wrists, legs, and ankles because everyone's playing at home and not watching what they're doing. We had one person riding their bicycle in the house when they received a fracture of their elbow. So please be careful. Show love to everybody, show humanity, don't be afraid, and join us tomorrow as we make some announcements and we'll further show you what's going on up here in Johns Creek, Georgia, how we're fighting the coronavirus. Thanks for tuning in. Thank you very much.